Hello, and welcome to The Mind of a Therapist, a podcast where we interview psychotherapists and helping professionals what they are passionate about in order to provide you with messages of encouragement and hope. The Mind of a Therapist is sponsored by Psychological Counseling Services, PCS, Healing Hearts and Transforming Lives. Please look into our intensive program at pcsintensive.com. I am Dr. Marcus Earle, the Clinical Director of PCS. Each episode will be hosted by me or another PCS therapist. Please enjoy the following discussion.
So welcome, Dr. Skipspeer. So happy to have you here. Actually very much excited to learn from you. And I wonder if we will start with the obvious, that you will introduce yourself. So what can we know about you?
Thank you so much for having me here. I really appreciate it. So again, my name is Dr. Skip Speer, and I am a clinical sexologist. I'm also a licensed clinical social worker in both the state of Texas and California. I've been licensed and practicing clinically since 1999. Got my start in adult mental health, severe psychiatric disorders, and really started concentrating on a private practice in about 2012, although I was doing therapy before that. And maybe in about 2015, started specializing in sex addiction, became a certified sex addiction therapist, treat sex addicts, partners, and couples. And then also in that work, after becoming a clinical sexologist, treating sexual dysfunction and sexual issues in couples as well. So maybe that's an introduction.
All right, this is great. So what are we going to talk about today?
Oh, I'm so excited that you asked, and I really am excited that you asked me here. So we're going to talk about the bulk of my work in the clinical sexology program at the International Institute of Clinical Sexology in Miami, which is where I received my PhD. And so the topic of my dissertation was small penis syndrome, and how does one treat that, basically. So what is that? And how does one treat that? And what I did is I came up with a group curriculum to treat that. So that's in general, and we'll obviously get in more detail about it.
Yeah, that's awesome. And I'm so happy that you focus on that because it's such an important issue that so many men deal with and doesn't really being acknowledged enough. And when I'm thinking about it is, I don't know that any client comes to therapy and say, this is my issue. And I don't know if therapists even bring it up or are aware about it. So what comes to your mind when I'm saying that?
I think 100%. I think to take a step back to think about what are the issues that can result from somebody thinking that their penis is small. And I'm using the language kind of carefully. So small penis syndrome, the definition of it, the very definition is that I think my penis is small, even though I'm presented with evidence to the contrary. Even though evidence to the contrary says scientifically your penis is not small, I still think that it is.
Okay, so it's the perception of, it's not the real thing. Okay.
Yes, it is the perception 100%. And so many clients are so embarrassed to talk about this to anyone, let alone seek help for it. And so what happens, as we can imagine, is there's, depression, there's anxiety, addiction can possibly result, sexual dysfunction, possibly personality disorder type things, and then especially things along the lines of body dysmorphia. That's where it goes.
Right. I can only imagine that how it might impact relationship.
100%.
If we even choose relationships, if this is our perception of how it impacts maybe my self-esteem, if this is what I think about myself. So it sounds like there are a lot difficulties that might come up with this perception, and it's not even real. This is what you're saying. So maybe the next question is, what is the size, the norm, right? Because if we have the perception that it's outside of the norm, what is the norm and how do we even measure it? Do we
Yes.
measure
Yeah.
it when it's erect? Do we measure it?
Yeah. So really amazing questions. And I did look at, so I got my hardbound copy of my dissertation out beforehand, and I was looking up things that you might ask me. So thank you for great minds thinking alike. So I what science says the average is 4.92 inches to 5.165 inches. So
Mm-hmm.
maybe we can say roughly 5 inches
Mm-hmm.
is the average size. So average, now I'm not really speaking scientifically, but does that mean then 4 inches to 6 inches is average? Is that within the normal range? One of the misconceptions that people often use is saying I have a micro penis, which
Mm-hmm.
happens, by the way, to be the only scientific definition of small penis. How do you quantify that? And so I did look up for a micro penis, flaccid measurements are 1.6 inches to 2 inches,
Mm-hmm.
and then stretched penis length. We can get into how do you measure, but stretched or erect would be 3 to 3.7 inches. So that is an actual micro penis. So if somebody has a penis that's 4 inches or more, then it's not technically a micro penis.
Right. Okay. And so how men do measure?
So the gold standard of measurement is called the Wessel's technique, Wessells. And anybody can kind of Google that and look, but basically, I think that science says that men are more concerned about the length of their penis than they are the girth, the width of
Mm-hmm.
their penis. However, if you're looking at a heteronormative level, more women are find sex more pleasurable with a wider penis than they do a longer penis. So the data, though, that we're looking at is typically on length of penis rather than width. And so it's talking about like from the top of the scrotum, the base of the penis, measuring from there to the top or the head of the penis itself. That's
When
how
it's
you're measuring.
erect?
Yes,
Okay.
yes,
All right.
exactly.
That's interesting what you said about women. So women are not really like bothered with the size as much as men.
Well, that's 100%. I wish I had pulled that statistic, but I have a whole chapter. And at the end, I'm happy to provide my contact info for anybody to reach out to me for further questions. But of course, men are so much more concerned about the size of their penis than their partners are. And it's interesting if you get into the gay community, perhaps,
Mm-hmm.
they might even, science may say that they could even be more um, concerned about the size of their penis than the average heterosexual man. But again, their partners are much less concerned about the size of their penis than these men are.
Yeah.
And even though they reassure the men of that, with this syndrome, the small penis syndrome,
Mm-hmm.
the men still, with all this evidence to the contrary, they still continue to believe that their penis is small.
Wow. Okay. All right. So is it a form of body dysmorphia?
I think it is. And so in terms of, I didn't even know that these conditions existed. There are three, I guess, what I would call diagnoses under the body dysmorphia umbrella. So, small penis syndrome, I define to you. Penile dysmorphic disorder is something that really is under the BDD, body dysmorphia spectrum, that indicates maybe more clinical distress. And then there's a scientific term called small penis anxiety. So those are the three terms that fall kind of under the umbrella. And yes, I think it is a type of body dysmorphia.
So how are they really different from each other? Because I'm hearing from you when it comes to body dysmorphia, it's more distress. So what does it mean, more distress?
And so I guess I'm so glad you're going back to that again. Clinically, when we're diagnosing something, we're looking at how does it impact their life in terms of day-to-day functioning in
Right.
relationships with other people, right?
Mm-hmm.
Perhaps their partners at school, at work, et cetera, and how much impairment is there with that.
Mm-hmm.
Um, so I think that the terms can sometimes are used synonymously, penile dysmorphic disorder, small penis anxiety, small penis syndrome, but there are nuanced differences that I'm happy offline to explain to anybody.
Okay. I'm. It's interesting because I heard that there is also another syndrome that is called Koro, and it comes from Malay, from the language that being used in Malaysia and some places in Singapore, Thailand, and it's more related to um, the fear of the shrinking of the penis.
100%. And I'm so glad you're bringing up the cultural issues. I've written about that in my dissertation as well, but it is basically a fear that my penis is shrinking inside of my body. So when I was spending a year on this work, I wanted to research kind of all conditions related to that, if that be, if I'm pronouncing it correctly, paruresis, which is being what we call pee shy, not being able to urinate in public,
Mhm.
to Coro syndrome, to other syndromes like that. So
Mhm.
yes,
Is
that's
it
the fear of my
related
penis
or
shrinking.
it's different stuff?
Well, um, I'm I'm not sure. I mean, I'm not sure if it is related or not. I mean, it's a psychological disorder that involves rather than this. I mean, I guess this the size of the penis, if it's shrinking, if I think my penis is shrinking, then I would think so, you know?
Okay, yeah. And it makes me think that you, with all your knowledge and everything you studied about it, right, there is maybe not enough research about these topics in general. And I wish there will be more because it's definitely deserving. I can only imagine being a person that stressed about the perception of their own size of the penis. And then, so if you can tell us more about, so what do we do with it? So
Good.
how can we treat that? Can we?
I really I appreciate that. And I'm the eternal optimist. So yes, I think it can be treated. And if you go back to say that, yes, research 100% is limited on this topic. It's something that men don't talk about. And so then if you get further into what my project was about, there I found one person that was conducting a group at an LGBT center in New York like 20 years ago. And I
Wow.
was unable to get a hold of him through the LGBT center to see what his curriculum was. But when I was looking for even specialists that treat this disorder, Joe Court is one person that I know that does, but and I found like maybe one other therapist online and doing tons of research of people that say they actually treat this disorder. And so we'll get into treatment in 2 seconds, but what happens is because men are afraid to talk about it, what do? They turn to the internet.
Right.
And so the internet is, of course, they're looking at porn, which is an unrealistic sample, that sort of thing, which makes people feel worse about themselves. And then the other thing the internet does is it encourages surgery, which is oftentimes dangerous, ineffective. So the bulk of my work is trying to prevent men from having surgery and instead treating the psychological component of it as well.
Wow. Yeah. So I assume you mean enlargement when it comes to
Yes, yes,
surgery. So men seek
100
more enlargement of the penis,
procedure.
right? And there is a danger that comes with it. Danger of going under the knife in general. Other
Yes.
dangers that you know of?
Yeah. So just the complications that can result, like one of the latest things that's being done are injections,
Mm-hmm.
to add to girth, and somewhat to length, but more to girth. And so do you end up with, I'm going to catastrophize, but an infection and
Mm-hmm.
then perhaps have to have a penectomy and not have a penis at all, or do you end up with lumpy, a lumpy penis, that's not uniform throughout? Is the fat reabsorbed back up into the body? So minor complications all the way to major catastrophic complications can happen. And again, are with
And they don't
cultural
even need
implications.
it because it's a
Right, right.
perception. Right.
100%. And are there backyard procedures that are being done by people that are not professionals? You know what I'm saying? That really do increase the chances of complications.
Yeah, so you just emphasize how important it is to do talk about it, to be
Yes.
able to have maybe a supportive community around it, right? Support, so I won't feel I'm alone in that. And I won't look for answers in the wrong places just because I'm really desperate. And I don't even get the right treatment because if it's a perception, it's a psychological thing, why would I go under the knife? There is no real reason for that. Yeah.
I love that you talk about you gave me a perfect segue in for group. Why am I choosing a group rather than individual? And certainly the curriculum that I wrote could be applied to individual therapy, but one of my mentors, Rob Weiss, a lot of us know in the sex addiction
Yes.
community, says, if finances are limited and you're going to pick one versus the other, pick group therapy over individual because group therapy can give you something I can't give you, can give you that sense of belonging and that sense of community. So that's why I turned this into a group curriculum more
Yeah.
than individual.
I love it and I really appreciate it because in a group we can see our story in others. We can relate to whatever struggles others going through and we can connect. So there is a room for intimacy there, right?
Mhm.
And then we are not alone. We don't feel alone in that. And so it brings us so much support and maybe someone to go whatever we go through and maybe even feedback. Hey, it doesn't make sense what you're thinking. So we start to have a reality check around that. Yeah,
Mhm.
that's a big
Mhm.
deal.
And I know I'm circling back a little bit, but when people are looking on the internet, which is where everybody goes these days to try to find help, what they're finding is you can imagine is, you know, shameful jokes, people making fun of, that sort of thing. They're not finding much seriousness out there in terms of treatment. And there's data that shows that men kill themselves because of this issue here. So
Wow.
just the importance again for group. Um,
Right. So a lot of shame, depression,
yes, yes,
that can end up in suicide, anxiety that you mentioned, relationship issues, sexual dysfunction. So, yeah, tough, tough.
yeah.
So when you think, you mentioned porn, and I love it that you mentioned it because how big do you think the impact of porn and comparison on that issue?
I think 100%. Well, I mean, I think it's a huge contributing factor because porn is so readily available these days. And, the age of people running up against porn is so much younger and younger. And again, it's not a realistic sample. It's a skewed sample where men with larger, mostly, men with larger penises larger than average, are going to be going on to porn. And so then men at home are comparing themselves to these men and getting an unrealistic perspective of what the average size of a penis is. So I
Right.
think it's a huge,
Yeah, yeah. And I wonder how it impacts the younger population, right? The young adults and maybe teenagers that watching porn and maybe never had an opportunity to, um, this is the only reference, right? And
yeah,
unfortunately, there is a reference and it's a negative reference. And yeah, how tough it might be.
yeah, absolutely.
Yeah.
100%.
So when you think about it's amazing that you are offering groups and
Hmm.
it's online groups. Is that
Hmm.
correct? Yeah.
Hmm.
So
Yes,
it's a psychoeducational group, so people can join from all over. It's not
100%.
limited to one state or another, which is amazing. And I wonder what are you gonna work with the clients in these groups?
And so what I did is I created a group that had 6 modules. And so the first module of the group, and it can depend on how long the curriculum can take, depending on how big the group is, how many questions, that sort of thing. But the first topic that's being covered is education, because I think people need to be educated upon what science says about the size of a penis. And, so we even go back and look at, from time, recorded time, the size of penis, how that's, been written for millennia, basically.
Right.
So education, dispelling myths, how do you measure the size of the penis? What do partners think about penis size? And getting into what are optimal sexual positions if someone really does have a penis that is smaller than average in size.
Hmm.
So that's the first module.
What are they?
Um, so there's in my work, I've written down 10 different positions, and I was not familiar with the title of many of them, 10 optimal positions, but the one that I was most familiar that I think a lot of us are is doggy style.
Hmm.
So and then again, I can answer those questions to somebody else if they're interested offline.
Yeah, wonderful. Okay, that's important information. So people come to the group. There are 6 models, and so one of them is introduction and giving the scientific facts, and then what?
Yeah, absolutely. So then what I try to do is think of what is the biggest consequence of thinking that your penis is smaller than average in size. And so to me, it's anxiety and depression. So those are the next 2 modules is, a brief primer on what is anxiety and how do we treat that, right?
Hmm.
And then how specifically is small penis syndrome, how how does that lead to anxiety? So that then a repeat essentially with depression. What is depression? How do we treat depression? And what is in particular with small penis syndrome goes hand in hand with depression. So those are the next 2 modules,
Yeah,
right?
right. It makes me think that how trauma might be related to that, right? Because we all
Mhm.
know that if someone tells us something when we are young, and we
Mhm.
internalize a negative
Mhm.
message, or it can be given to us or we give ourselves, then sometimes it's stuck there, right? And this is what I think about myself, and I repeat and repeat, and it's can impact my negative self-talk, my self-esteem. So maybe bullying that I went through,
Mhm.
or any.
Mhm.
So,
Mhm.
what do you see? Like, what did you see about that?
And I think trauma goes, hand in hand. The messages that they could have perhaps gotten from somebody at a young age, or partners, or peers, or that sort of thing growing up. And I also try to not, some people can get into small penis humiliation and it can be a kink for them. And, I'm trying to not put a judgment upon that. Maybe that's not necessarily a bad thing if it's not hurting them and it's not hurting other people. So there's the sex positive side of it back to treating the actual underlying trauma itself and the messages they got, growing up, coming from that. And the trauma piece, of course, I think would be best dealt with in individual work.
All right. So during the group, do you do the people listing their negative beliefs, or maybe incidents in their life that might related to that? Because it can be even parents remark about our body, and then we shame ourselves.
Mm. Well, and I'm skipping ahead now in
Yeah.
terms of, so if we start with education, then we have anxiety and depression, and that's basically educating on all those things. What is the actual treatment? I mean, I get into science-backed, gratitude even, perhaps, or breath work. But the next 2 modules that come up are mindfulness, because that's the one of the number one treatments for small penis syndrome that is out there, and cognitive behavioral therapy. So that's where you're going. So what I talk about is what is cognitive behavioral therapy? What are the cognitive distortions? What are the negative messages that I'm saying to myself? And how do I change those? How do I rewire those?
Right, beautiful. And the mindfulness related to being in the present moment, see what it is. being grateful for what it
100%.
is.
100. And even this is was an interesting piece of the work and the research is during sex and having sexual performance anxiety that anybody can have. But if I'm thinking my penis is smaller than average in size, that could contribute to it more, which could lead to erectile dysfunction. So how do I be in the present moment sexually with my partner and not be caught in my head with
Right.
those kind of thoughts?
Yeah, yeah. You mentioned kink. So how is it related? What do you mean exactly? Like how can it
Well,
be maybe a positive?
and again, I think myself and society can pathologize kink so much. And so, could there's very little that I wrote on this, but small penis humiliation again is something that people engage in and find satisfaction out of and find sexual satisfaction and inside the bedroom and go on to lead a very quote unquote normal life outside of the bedroom, but in the bedroom, that's what they're engaging in and it's satisfying for them.
Hmm. All right. Yeah. Sounds good. Sounds really, really good. Sounds there is a place to go, a place to be heard, a place to be seen, a place to be validated for the difficult feelings, the distress, and
Mhm.
to maybe even find comfort and support with others.
Yep,
So, how
absolutely.
individual therapy can complement that?
It's interesting when you say that, and I've never thought about this before, but I'm trained in dialectic behavioral therapy, and the protocol was written to have individual therapy and group therapy at the same time.
Mhm.
Group being skills training, taking a class, and an individual implementing what one learns in the group, in the skills training into their everyday lives. So, could the individual therapist kind of be helping serve as accountability and apply those principles learned in group into their everyday life?
Right. And I know that you are EMDR therapist trained,
Yes,
like
yes,
myself, and I can only imagine how EMDR can be so helpful. Eye movement, desensitization, and reprocessing to help client reprocess in an experiential work, right? The negative beliefs about themselves and
yes,
actually targeting the trauma bottom up, what we call, and not top down, because it's probably live in the trauma area and not
yes,
in the making sense area because it's perception. It's not even real.
right. 100. And I love that you bring this up because I'm not going to quote Francine Shapiro, who is the EMDR, the inventor, the creator of EMDR, but her goal was twofold, right? So
Right.
desensitization to turn the volume down on traumas. And now we're using EMDR protocols for many other things besides trauma. So turn the volume down. But I think that she said if she had to rename it, the more important piece of that is the reprocessing work that people do, like shifting, in their mind. Are these things unresolved and how do we get them processed so that they're not on a loop in our mind and playing the entire time, right?
Right. So when I'm thinking about your the group, right? How do you even screen who are the people that can come in? What do they?
Mhm. It's interesting because my dissertation was kicked back because I wanted to be all inclusive. I wanted to, in my project, include anybody that felt like they had a penis smaller than average in size, including trans men.
Mhm.
And the International Institute of Clinical Sexology was like, they were concerned about putting everybody together in a group. So they wanted to limit it to people that were born male, and not include cancer victims, people with penectomies, that sort of thing in the group itself. So for phase one of the group, when I run it, I am going to follow that protocol and limit it to men that actually do have a penis that they think is smaller than average in size.
Mhm. Okay. All right. And for the future might be other groups.
100%.
Yeah. And the
Yes.
reason for the limitation for now is what? What was the rationale behind it?
I think that the rationale was putting everybody together in one room. Men that actually do have a penis could say to, somebody else, I actually have a penis and you don't. And so that is the actual, issue, and so I think the social worker in me wants to be all inclusive,
Right.
but I think limiting it right now to people that actually were born with a penis, I understand the rationale for it.
Right. Yeah. And cancers, you spoke about cancer, why to rule out cancer?
So what I'm saying is if somebody had penile cancer and had a penectomy,
Hmm.
and so they no longer have a penis,
Gotcha.
that's another entirely different condition.
Right.
Then getting back to what you and I were talking about, what you so clearly emphasized, this perception in my head
Right.
that my penis is small, even though it really isn't,
Hmm. And
right?
maybe in the future there will be support groups or therapy groups for people that share that. So
Yes,
experience cancer and they can get more, because they can feel alone in the place that want to feel together. Yeah.
100%.
Beautiful work and such an important topic. And is there anything else that you want to add?
I just really appreciate you taking the time to have me come. And I think it's an issue that we don't talk about enough. And I appreciate the platform. And I guess my question for you is how do people contact me? Do they get a hold of you and you provide my contact info? Do I do it now? What is the best protocol for that?
Oh, um, so Dr. Skipspeer,
Yes,
right? Located in
yes,
California,
yes.
right? And yeah, if people can Google or you can give your information now, that's
Yeah,
okay.
I'm actually happy to do that. So I'm going to be bold and give you the work phone number I've created for this work. So you can always call me or text even at area code 213-545-6657. That's 213-545-6657. And I'll give you the web address of the group itself, which is sppigroup.com. So that's S P as in Paul, P as in Paul, I group, group.com. And so they can find more information there.
Yeah, wonderful. I can only imagine that if we will Google small penis, we will find it will be so many results that it just emphasize how much it's an issue in our society.
100%. Absolutely.
Yeah, yeah. Thank you so much. So happy to have you here. Really appreciate it, and maybe we'll see you again in the future.
So lovely to be here. And I really appreciate you asking me. Thank you so much.
Please press the subscribe button, as well as rating and providing a review of our podcast. This helps others to connect with what you have been hearing. If you have any questions, please contact us at themindofatherapist@gmail.com. These questions will be kept anonymous. I want to thank Eric Price for the wonderful music you hear in this podcast. Additionally, this podcast was created to provide accurate and authoritative information on the subject matter. Although we are interviewing licensed therapists, they are not your therapist. This podcast is not intended to serve as direct medical advice and should not be used as a substitute for direct professional help. It is given with the understanding that neither the host, publisher, guest, or PCS are rendering legal, medical, or clinical professional information. If you need a professional, we encourage you to find one. Visit Psychology Today to find a licensed clinician near you.